Marham Green's been open 2 years and it's a unique, very sheltered housing scheme in the sense that we provide lots of other different services here. And it also comes with a gym. The hub's been open since August. We had a fantastic open day, lots of interest from the public, the general public, as well as our residents and their families and their friends. And it's been a huge success, it really is, and we are actually seeing the benefits to those people that have had strokes, that have dementia, and any other complaints that they have had.
Yeah, if only I could go a bit quicker.
I'm sure you can get an engine on it. Yeah. Okay.
We've basically came to this point where we realised that Kessingland was one of the areas that had high levels of deprivation and also high health issues which we needed to focus on. So putting the community hub in Marham Green seemed a logical solution. Working with Flagship and Jane, we've managed to secure the room rent-free for 5 years. So we've just simply put in some equipment that was supplied to us by Technogym, and we staff it with high-level instructors which work for us on a subcontracted basis. We're really looking to extend the gym into other activities as well, and these activities will actually be decided by the community and also the residents here. And we will just facilitate using the staff that we have around us to make this happen.
I would never have gone to a gym. I don't like the speed that everybody goes at, and you're in a room where it's all hot and sweaty, I should imagine. I've never fancied that at all. But here, you've got your own pace. It's not too strenuous. You don't feel you're going to hurt yourself. You can be as gentle or as strong as you like.
We really want the centre over the 5-year period to grow to be a community thing, really run for the community, run by the community. We're just merely there to add our expertise and sort of help that process. The overall aim is that we should be able to deliver up to 40 hours of exercise to Kessingland and the local area.
I'm actually the administration assistant, and I obviously do all the paperwork for the scheme. And one of the main reasons why I'm using the gym, not only because I'm a member of staff, is because I've actually got a health issue. I've got degenerative disc disease in my spine. I think it's marvellous, absolutely brilliant idea. We've waited a long time for this and it's really exciting.
It's just a social occasion, and we all have a laugh as well. That's the nice thing about it.
I've seen many times in many job roles I've had through exercise how physical activity can change someone's outlook to life. It helps to promote positive thought, makes people realise that they can do things that they never thought possible. And this transfers not only into physical activity but just also into their life and their own sort of goal setting and aspirations.
I haven't lost any weight yet, but I feel that it's toning me up a bit, and I'm not aching so much. It just makes you feel more supple, a bit more agile, and it helps with walking. It makes it all much easier.
I've always been very keen in fitness, and to be honest, this goes back from when I was 12 years of age. I was a severely overweight individual, actually put into special needs groups at secondary school because my mother had just died, and I wasn't really dealing with it very well. I was introduced to a doctor who was actually an athlete himself, and he just simply said, "Come along to a running club." And that changed my life. I'm a very keen athlete myself, run marathons and do fundraising. I actually hold 2 Guinness World Records for running marathons in costumes to help with fundraising. And while I was working in the private sector of sport and leisure, I realised that a number of people that were coming into our membership actually had health issues as well. And it sort of drew me to thinking on how we could help perhaps improve some of them. And after doing some sort of small pilots, very much against the wish of my private company at the time, we realised how much impact we could actually have on the outlooks of people with minor medical issues. So I've sort of decided that at that point I needed to be in a more sort of medical sort of arena. And hence I saw the opportunity to become a physical activity coordinator. From taking that job role, that's allowed me to sort of start building these projects, and this now leads us to this position where we're starting to now put gyms into community settings and being able to work with a more health focus rather than a performance-related focus. At Beccles, we've got a very exciting hub. It's the first one that's going to be placed inside a commercial gym. This is going to allow us to develop a training academy, because one of the things that I've noticed since being involved in this is the need for instructors to be qualified to the level to work with these conditions. Working with the Right Foundation, we now can provide a training centre for these courses to be delivered. And through unique partnership working, this obviously has a massive cost saving to us, because we're allowed to skill up our instructors at a discounted rate. But at the same time also offer a local training academy rather than having to access other areas of the country for that type of training. That will be a massive project, and hopefully this will only support the other hubs that we have.